Welcome to Pieces for My Puzzle. I am your host, Nikki Ship, and I'm excited to be sharing with you my life with a son on the spectrum. This podcast is for anyone who is looking for quick tips and perspective, but most of all, for hope and inspiration. So sit back, relax, and let's put the pieces together. And welcome back to another episode of Pieces for My Puzzle. I am your puzzle master, Nikki. Thank you so much for joining us today. Last week we talked about how to get outdoors and do some camping, and we gave some quick tips on things that you can do. So hopefully you'll be able to put those tips to good use. This week we're actually going to talk about a subject that's actually near and dear to my heart. We're going to talk about going to the dentist. So actually, for those of you that, I don't know if I've ever mentioned this on a podcast, but I'm actually a retired dental hygienist. I was a hygienist for 17 years, actually. So that's partially why this subject's so near and dear to my heart. But I have to be honest with you, even for me, it was really hard to find a dentist that was well-versed in special needs and had an understanding or a familiarity with autism. And so I decided that I wanted to give you guys some quick tips of some things that you can do when you're taking that visit to the dentist, and also when you're looking for a dentist, some of the questions and things that you might want to ask. So especially for a child on the spectrum, for Drayson, it took us a really, really long time to find the right dentist. And oh gosh, I think we had three or four unsuccessful attempts where it wasn't the right environment. There's so many other things that we had to think about. Sensory, kids on the spectrum can have a lot of sensory overload. There can be scared of the unknown, and there also can be a cognitive challenge, right? They might not fully understand why you're trying to lean them back in a chair and shine this bright light in their face. And so sometimes things need to be approached differently within dentistry in order to get the job done, right? So I'm going to give you some quick tips on how to find the right dentist. And first and foremost, ask your community, do some research online, but ask people that you know in the area, or if you're a part of maybe a Facebook group or some sort of community group, ask if they could recommend a dentist, a pediatric dentist, one that's maybe well-versed with special needs, and do some research. Like I said, it took us a long time to find the right dentist for Drayson, and we just, this past year, right after his 10th birthday, found a dentist that we just absolutely love, and he does a phenomenal job. And that's all he does is special needs, so it worked out perfect for us. When you call the dental office to make the appointment, interview the staff. And if you have to, maybe swing by there, walk in and make the appointment, get a feel for the office, see the surroundings. Do they specialize in special needs? Do they see all kids? Are they familiar with autism? Do they have any extra training in autism? Also, other questions to ask is, do they do sedation on site or have any other expanded services like orthodontics? The reason being is sometimes you want to keep the environment familiar for your child. So, for example, Drayson's dentist that we take him to, can also do sedation there. And when he gets ready for orthodontics, they do orthodontics as well. And so that's really important to make sure that you're kind of familiar with what might be also needed in the future. Drayson was definitely going to be a candidate for braces, so I wanted to make sure that we could take him to a place that was also close to home because of multiple appointments, but also still a place where he's still familiar. So we don't even have to change offices. We can go there for ortho too when the time comes. So that was a win-win for us. Do they give extra time if needed? This is really hard because for all of my other fellow dental professionals out there, you will agree that sometimes we have to live by schedule, right? And sometimes our schedules are strict and it's quick and it's rapid pace and we have to hurry. So a question that you do want to ask is, do they allow extra time if they need it? You want to make sure that they're going to be patient with your son or daughter? And also, do they know what to do if a behavior occurs? Are you allowed to go back with them? Do you need to stay out in the waiting room? What would be the best thing to do in order for it to be a smooth running appointment? And also consider time of day. Do they accommodate special time of day to bring in your child? For example, Drayson does much better in the morning than he does in the afternoon, so we set up his appointments in the morning. Also ask, and this might sound like a little bit of an odd request, but also ask if you can take photos of the place to show your child. Giving them a visual is going to be highly beneficial. So maybe taking a picture of the front of the office, a picture of the waiting room, a picture of a staff member waving, a picture of the operatory, things like that, so that when they walk in, they're already familiar or have a picture in their head of what it's going to look like. This isn't just within dentistry. This is any place. Drayson gets a little fearful at first to walk into any place that he doesn't know. So by setting that up a little bit more, there's not so much intimidation for him. So this is why I suggest, maybe taking photos. Consider doing some role playing at home. Play dentist at home. When I say that, I mean assist with toothbrushing, or play dental hygienist at home and assist with toothbrushing. Put on a pair of gloves and just act like you're just very gently looking in the mouth so that they can feel the sensation of what a gloved hand feels like in their mouth. I know that sounds odd, but believe it or not, the more you can get them familiar with that, the better. If you assist with toothbrushing or assist them with flossing already, it's not going to feel so awkward to them when somebody is putting fingers or hands into their mouth. And the other reason, too, is if you have a child that likes to bite down, you want to maybe condition them to not bite down. And your dental professionals will greatly appreciate that ahead of time as well. But again, I know that sounds odd, but put your fingers in their mouth and let them get used to the feeling of what a gloved hand is like, and just very gently. You don't have to pull or yank or do anything like that, just so that they can feel it maybe along the side of their cheeks, along the ridge or the side of their teeth. But you almost want to desensitize them a little bit. And this is something that I did do with Drayson, just so that he would get used to the idea of somebody, putting something in their mouth. And autistic or not, it's intimidating for everyone, right? When you go to the dentist, I mean, you're laying down in a very vulnerable position. Somebody's shining a light in your face, and so we can all agree that that's a little bit intimidating. So imagine for a child when they have sensory issues or their intake is much higher volume than what our intake is, it can be extremely overwhelming for them. If you have in-home care, such as ABA or OT, for example, we have ABA therapy and we have occupational therapy that comes to our home, you can talk to them about organizing a goal around toothbrushing so that they're familiar already with good oral health care, and that also helps encourage them to brush their teeth and floss their teeth. So those are goals that you can maybe incorporate. We had Drayson's occupational therapist work with him on brushing for 2 minutes, and the dexterity of moving the toothbrush with hand-eye coordination and just helping those gross motor skills was really beneficial for Drayson. You can also research social stories about going to the dentist. There's a lot on YouTube. If you look on YouTube, or even Google social stories about going to the dentist, and again, give them a visual or do some storytelling about a trip to the dental office, just so that they have an idea of what to expect when they go. And here's the big one for me, folks. Practice good oral hygiene. Here it comes from your retired dental hygienist, but make sure that you are encouraging good oral hygiene. Start them on an electric toothbrush if you can as soon as possible. And I do realize that this is difficult for some kids because of sensory, but Oral-B and Crest make really fun ones with designs on them. You can even take your child to the store and try to involve them in that decision. Ask them to pick one out that they like. Maybe they have a favorite character. Drayson, we're a big Star Wars family, so of course Drayson always wants like the Darth Vader electric toothbrush, but get them used to an electric toothbrush as soon as you can. All right. And try to use, you might have to use kids' toothpaste for a longer period of time. Sometimes the mint flavored toothpastes are way too overwhelming, and it might take a little bit of time before they do start using other toothpaste that maybe has a more mintier taste. But we don't want the taste to be too overwhelming to them as well. So consider using a toothpaste that maybe is more of a kid flavor. And even up and through teens, you might have to consider doing that if the mint taste is too overwhelming for them. They do make special toothbrushes. If a regular toothbrush does not work, they're called three-sided toothbrushes, and that is something that you can do with toothbrush when you assist with toothbrushing, is use a three-sided toothbrush. Flavored floss and floss picks might also be helpful. You may need to also assist if they struggle with fine motor skills. The floss picks did not work for us because Drayson, his contacts were super, super tight, and the floss would just break on that floss pick. So we use regular floss. He does not personally like the flavored floss, so we just use unflavored waxed floss for him. So also keep that in mind. But if they like bubble gum or raspberry or grape or things like that, you can always try to find some flavored floss as well to get in between their teeth. Timers also help with brushing. You can have them brush even the length of a song, at least 2 minutes. At least 2 minutes. I'm going to say something really shocking here. The average person brushes their teeth for less than 30 seconds. So brush for at least 2 minutes. And maybe play a song or put on a timer. We have a little like salt timer that's 2 minutes that Drayson really likes using. So once that timer runs out, he knows that he can go ahead and rinse and be done toothbrushing. And show excitement. This is a tough one for some people, but be excited about going to the dental visit with them. Do not let your predispositions or your past experiences influence theirs. Dental anxiety is very, very common, and it's natural. People have had dental experiences that have not been the best, and I have to say that dentistry has come such a long way, and children can have a great experience at the dentist. So do not let your fears of your past experiences translate to your child at their dental visit. And also, encourage them to brush and say things like, let's get rid of sugar bugs, but try not to say things like, if you get a cavity, the dentist is going to have to pull your tooth or is going to have to drill on it and fill your tooth. Try not to say things like that as a scare tactic to get them to use good oral hygiene. Maybe just try to explain to them that they have germs or bugs in their mouth and that we want to get rid of those bad bugs so that they don't get a cavity. Try with some simple terminology like that. And I'm speaking from years of experience where I would hear parents say this to their kids, and I thought, oh my gosh, they're terrifying their child. Or they would show all of their fillings and say, see what happens when you don't brush your teeth? This is what I had to do. And it can scare your child. Before they even walk in the door, they might have a predisposition about the dentist. So that is probably one of my biggest tips that I can offer to you is do not let your past experiences influence them. In fact, you might be surprised to see how much dentistry has evolved over these recent years. Take their favorite item with them, maybe a blanket or a toy, something that they really enjoy having and that they can hold while they're in the dental chair. Drayson has a blanket that he really enjoys using. And then I also came prepared with additional items. So if sounds might bother them, make sure you have their headphones ready to go. If you think it might be too loud for them and they're going to need a pair of headphones. Drayson likes stickers, so a lot of times I would have stickers in my purse, and every time he did something in the chair, I would hand him a sticker. So he sat in the dental chair, give him a sticker. They were able to lay him back in the chair and put on the dental light, give him a sticker. And you can just put it right on their shirt for them if they want it, but it's a sense of them feeling as if they're getting a reward for doing something. Okay. Monkey noodles is another one, something that they can hold but not fidget too much with because we don't want them to move too much, but something that they might just be able to hold and use as a sense of comfort for them. Let the staff know your child's likes and dislikes, okay? And take breaks if needed. So let them know ahead of time. Maybe when you call and make the appointment, they can make notes in that chart. So make sure that you let them know that the bright light really is intimidating for them, or they're not quite comfortable laying back in the chair all the way. Give them kind of a heads up, or they've been to another office and we didn't have a good experience. So let them know so that they have an understanding and that they can maybe accommodate some of those likes or dislikes. They can modify the treatment if they need to. And then reward them. Plan something fun after each visit. Take them to their favorite place, or maybe treat them for their like a favorite lunch or something like that. But plan on doing something fun with them after as a way to reward them, and just let them know how proud you are of them for them making it through their dental visit. High fives are a big deal in our household, so giving them a high five and taking them out for an early lunch is something that we definitely try to do after we take him in for his appointments at the dental office. At the end of every episode, we want to do a story highlight. And so if you have a story that you would like to tell us about your kiddo, one maybe a moment of triumph, or where you felt that you overcame some adversity that your child was facing, please feel free to email our show in at info@piecesformypuzzle.com. Today, I'm going to tell you, obviously, Drayson's first true and happy visit going to the dentist. I just felt that it was fitting, obviously, talking about this topic. But it took us, like I said, a long time to find the right person. And we prepped Drayson well in advance. I think we started talking about going to the dentist a couple weeks every day beforehand. And we also put it on his calendar so that he could see when the day was coming when he was going to go to the dentist. We also prepped him with social stories, watching some social stories. And then we did talk to him. I did talk very actively, to the dental office about Drayson. This office in particular does also work specifically with special needs kids, which is why I felt comfortable enough to take him there. And I noticed that they made a lot of notes. So when they called and confirmed, the girl on the phone with me actually confirmed back the details that I had told her about Drayson's likes and dislikes and some of his prior experiences that he had. So, and then we also talked about what we were going to do after we went to the dentist and letting him know that we were going to go do something fun. So when we got to the dental office, this place was so cool that I probably could have hung out there all day myself. He had video games and arcade games and everything Disney that you could possibly imagine. But Drayson's favorite thing was a life-size Darth Vader that was there. And we told him that after he had his visit with the dentist that maybe we could take a picture next to Darth Vader. And so that was also an incentive that we were able to use. The dentist was amazing. He came in. Drayson was not comfortable sitting all the way back in the chair. It was a trust issue for Drayson. And the dentist came in prepared. He had on his eyewear with actually a mounted light on top. So he had his loupes with his light. And he also had a light on his mirror. And he was able to illuminate and look around. We were not quite ready for x-rays yet. He still has had a really hard time with x-rays. And the dentist said that at the next visit, we are actually going to bring him in more frequently, every 3 months. And so that also helps him with getting used to going to the dentist. Is in the beginning, you might need to consider more frequent visits just so that they can get accustomed to coming to the office. So the doctor suggested he comes back in 3 months. He actually was able to brush his teeth and also use a tooth polisher and was able to get into his mouth. But what I loved about this dentist was that he got down on his knees and got eye level with Drayson right there in the chair, even though Drayson didn't want to sit back in the chair. And he just talked to Drayson and explained what he was doing. And twice in that appointment, Drayson mentioned Darth Vader. So I knew that that was my leverage. And I told him each time that we would take a picture after we were done. So he wasn't necessarily focused on what was really happening in the dental visit. He was more focused on being able to take a picture with Darth Vader afterwards. So And then we were able to take a full tour of the rest of the office and see all of the wonderful Disney. He had a ton of movie props from Disney and Star Wars, and it was really, really cool. So overall, it was just a perfect experience, because I will say, like I said, he did have a couple other dental experiences prior to that unfortunately weren't as heartwarming as the one that I'm describing to you right now. So again, if you have a story that you would like to tell, please feel free to email the show in at info@piecesformypuzzle.com. This concludes our episode for today. Thank you so much for tuning in. Please like and follow us on Facebook and Instagram, and feel free to subscribe to our YouTube channel as well. If you like what you're hearing, please spread the word out to others in the community so that we can help offer more support and resources for the autism community. And feel free to give us a good rating as well on your preferred podcast platform of choice. We would love to see those ratings from you. Until next time, keep working on your puzzle, and remember, you don't have to have it all solved in a day. Take care.